Hey everyone, this is FMA1 Case Study of a Nursing Administrator under N240 Concepts and Principles in Nursing Administration. My name is Mark Anthony Zamulio and I'm one of the training specialists for Project Maryland in Shearwater Health Philippines. I am currently reporting to Vanessa Jimenez. She is also our interviewee for today. She is the training supervisor for both Cleveland and Maryland projects. She holds a PH and USRN licenses and has bedside and utilization management experiences. She also has led a team in her previous company in both training and in operations. Before we discuss the interview process, let's define what utilization management is. So, this is a process that evaluates the efficacy, appropriateness, and medical necessity of the treatments, services, procedures, and facilities provided to patients on a case by case basis. It has three main types of reviews. Number one would be prospective review. So, this is performed before or at the onset of treatment on a case by case basis. This review is designed to eliminate unneeded services. The chosen treatment should be considered contingent and may be changed later. Concurrent review is the type of review which occurs during the course of treatment and tracks a patient's progress and resource consumption, which may cause in process care procedures to stop. And lastly, retrospective reviews. Conducted after treatment is done, the review assesses the appropriateness and efficacy of the treatment in order to provide data for future patients. Now let's listen to my interview with Vanessa Jimenez.
Hey Van, good morning. So let's start the Q&A portion. Let's proceed with question number one. What are your motivations as an administrator?
Hi, Mark. So, my motivation as an administrator is to be better in what I do, especially in ensuring that my direct reports are able to achieve, their daily tasks and what they really aspire for, even outside of the organization.
Alright. How about your leadership qualities?
Hmm. For leadership qualities, I think I am very decisive and highly adaptable to new skills. I always make sure that my direct reports are highly praised, especially in the presence of our stakeholders, to keep them motivated and inspired at work, along with correcting them in private.
Alright, that's good to hear. Can you tell us more about your critical thinking and so as your decision-making skills?
Hmm, that's a tough one, but by making sure that all stakeholders can get the support that they need, as well as my staff who needs guidance, especially in decisions that are highly critical and impacted.
Alright. How about you handling conflicts in the workplace?
Hopefully, there's no conflict, but we cannot avoid that. So I just always maintain my impartial disposition in resolving conflicts, along with delineating the line between being a lead and a friend to my staff.
Okay. Do you happen to have any financial or entrepreneurial skills that you want to share?
I don't have any business, but I think I have learned that being insured is an integral aspect of adulting. So this can help us be financially independent and be ready for anything that will happen in the future.
All right. And since we are currently in the pandemic and we are currently working from home, in relation to this, can you
Mhm.
tell us how do you use technology by means of your decision-making processes?
That's very timely. So the use of email, instant messaging, and other social media channels that you can think of can be used as a way of communicating to staff and other people in the organization. So apart from the use of Microsoft Office in presenting and creating processes that are readily available to staff.
Alright. Down to my last question, Van. What's your
Mhm.
involvement in policy making?
Hmm. I think my involvement in policymaking is geared towards process improvement and learning as I am part of the training team. So I always consider long-term effects of processes in place to be of great help to all the staff and in helping my own staff, of course, to be efficient in training delivery.
Alright. I think that's pretty much about it. Thank you so much for your time, Van, and I hope you have a great day.
Thank you.
Well, basing the basing her answers, let's talk about the analysis on the interview process that I've had with my supervisor. So this will be covered on the following bullet points as shown on the screen. So we have leadership style and communication, relationship building, goal setting, problem solving, group building, decision making. So as management functions and modalities. So first, we have leadership style and communication. Democratic or participative as she values her staff's motivation to do what is expected from them and beyond. This also reflects how she focuses on her team's dynamics so as including them in the decision-making process. Lastly, she maintains an open and non-aggressive type of communication where everyone is welcome and suggestions are very much appreciated. I strongly believe that this type of leadership is applicable to almost every organization. It is vital for each staff to feel that they are heard regardless how irrelevant the idea may be, as this fosters better outcomes from the staff. Next would be relationship building. In terms of relationship building, she has underlined the importance of creating harmonious relationships, not just within her team, but with other teams in operation and quality. She ensures that all key stakeholders are aware of what's the status quo in training. Building ties to every department ensures everyone's success in an organization. Most of the staff reasons of being disengaged at work is being left behind, and organizations sometimes fail because of being not inclusive. Next, goal setting, problem solving, group building, and decision making. Based on the interview, Van's involvement in our department's policy making is geared towards process improvement and learning, which is everyone's business within the training team. We are also aware to be in line with all the processes in place that the clinical staff are also doing the same. Van values each of our individual contribution, no matter how big or small it may be. She always asks everyone's consensus just to make sure that we are accountable and responsible with the decisions that might impact other teams. Management functions. When asked about her motivations as an administrator, Van was able to show that her staff is her responsibility to guide and develop apart from completing her individual tasks every day. This only shows that she wants us to succeed in our work and clearly manifests her eagerness for us to improve, develop, and learn. And lastly, for modalities, we are focused on nursing care management. We have identified utilization management, but to further discuss this, our job is not simply checking for medical necessity, but to ensure that patients receive the appropriate treatment they need by enhancing coordination of care, eliminate duplication, and helping patients and caregivers more effectively manage health conditions. And that's about it. Thank you so much for your time, and I hope you have a wonderful day.